Hi, greetings. My name is Joel Siegel, and I am Representative John Conyers, the best member of Congress, Senior Legislative Assistant on Healthcare, Veterans Affairs, and Housing, and many other issues. H.R. 676 is one of the most important pieces of legislation in the U.S. Congress, and according to Mr. Conyers, the single most important legislative initiative he has ever done in the over 40 years he's been in the U.S. Congress. I'm someone who owes over $100,000 in medical bills. I've been kicked out of hospitals because I was uninsured. I've led a life where my credit is destroyed from healthcare bills. I can't even get a cell phone in my name, and I can't even get a car for my daughter in my name because of my credit. Our healthcare program in the Congress, which is a Blue Cross Blue Shield benefits package, which is often touted as the best healthcare program, for government workers, is really, that's not the case at all. In fact, I owe over $4,000 in copays just in 1 year from 2 visits to the hospital for bronchitis and some other ailments. And the beautiful thing about H.R. 676 is that would all be history. You'd get a card. You would go to any hospital that you wanted, any doctor that you wanted, and your health care is taken care of once you get that card. You don't have to worry about whether or not the insurance company is going to cover you, whether or not you can pay the outrageous cost of their monthly premiums. You don't have to deal anymore with pre-existing condition clauses. Wouldn't it be nice if you can actually go to a job with health care already, not have to get a job to get health care? That's why we need universal health care. Under 676, it covers all medically necessary services, dental, prescription drugs, mental health, long-term health care, and even some chiropractic adjustments. Furthermore, the reason why H.R. 676 is important is because you also have free choice of all providers and doctors. Once you have your card, that card travels with you. The system is portable. So if you're from North Carolina, where I'm from, you can get your services in North Carolina as long as you got the card. Or if you're in Oregon, because you're vacationing in the beautiful city of Portland, which I've been to before, you can also get services there. Now, many of you would say, that's impossible. How could that possibly work? Well, if you look at our good neighbor in the north in Canada, that's exactly how it's done there. That's how it's done in Europe. That's how it's done in New Zealand, Australia, South Africa, Japan, almost everywhere in the world but here. What we do in our bill is we take the role of the private health insurance company and we change that. They would not be able to cover medically necessary services if it duplicated the federal government's national health insurance plan. They would have a different role under our bill. One thing that could be done, this is not explicitly in the legislation, but insurance companies could be subcontracted out by the government to do reimbursements just as they are currently under the Medicare program. All that means is they would push the button for the reimbursement, that when the doctor reimburses for services, they would electronically push the button since they've already been trained to do so. The other beautiful thing about our bill is there would be cost containment in our legislation. How is that? Well, it's very simple. Under the current for-profit healthcare system, you can't contain the escalating cost of premiums or hospital costs because there's no incentives to do so under a for-profit system. Under our bill, doctors would be reimbursed through set fees, number one. Number two, hospitals and long-term centers would receive what's called a global budget. That's a lump sum of money, either on a monthly basis or an annual basis, so they can, operate efficiently and make sure they have quality programs and not run out of money all the time like they are now in closing and firing nurses and not being able to hire adequate staff or resident physicians because of lack of funding. Europe has a much higher role in federal financing than we do. We want to try to change that through global budgeting. There'd be no such thing as a for-profit hospital anymore. Every hospital would have to be a non-profit hospital to participate. the program, and that's how you keep the cost down. Furthermore, stockholder medicine would be illegal. You could not have stockholder-driven hospitals or long-term care centers, which always escalates the cost of health care because you got to pay out dividends to stockholders. Well, that's when your premiums go up, and that's when your long-term care costs go up. Also, there would be bulk procurement of prescription drugs. That means the federal government would be able to buy the prescription drugs and bring the price down of those drugs, which are incredibly expensive now. In fact, the Veterans Administration gets about a 40% reduction in their cost of prescription drugs because they do it exactly the way I just explained it through bulk procurement. Now, in order to get H.R. 676 passed, we have about 72 co-sponsors. We'll need a movement just about the size of the civil rights movement in the 60s. And currently, we're well on our way with over 93 cities either planning town hall meetings for 676 where they're compelling their members of Congress and elected officials to be held accountable and to ask them what their stand is on universal health care. Over 143 labor unions now support this bill, and probably about 12 international unions, including the Steelworkers, UAW, so forth and so on, PACE, are now supporting single-payer national health insurance. Now, that is a major, I would say, seismographic change in the climate for universal health care that we didn't see during the Clinton 1994 universal health care proposal, which was not necessarily single-payer, but we can take lessons from that. And labor now is with us. Over 13,000 physicians support 676, so the physicians are with us. This movement is growing stronger every day, but without citizen support, it'll be difficult to pass this legislation. We need to get Democrats elected, both in the House and the Senate. We need a Democratic president. That's when the real fight will begin, when progressive Democrats are elected throughout this country. And, of course, my boss will become the chairman of the Judiciary Committee. Then the real fight goes on within the Democratic Party about what kind of health care system we'll have. That fight won't go on if you have a Republican-controlled Congress. It's not true that both parties are the same. Both parties are influenced by money, but there's a big difference between John Conyers, for example, and Trent Lott. They're not the same. There's a big difference, for example, between Charles Rangel and Bill Frist. So we need Democrats elected, just as Martin Luther King pushed Lyndon Baines Johnson to do civil rights because there was a Democratic Congress there. We need to do the same where we elect a Democratic Congress and president and push Congress to pass H.R. 676. So all I can tell you right now is there's 45 million people who desperately need health insurance. They really shouldn't have to wait. There's the second leading cause of bankruptcy in this country is unpaid medical bills. More families shouldn't have to wait before they too go bankrupt. There are people who in this country need prescription drugs for various chronic illnesses. They shouldn't have to wait. There are people who need breathing machines, like I used to have to raise money from friends and family because I have sleep apnea. People shouldn't have to raise money to get their health care. It should be a fundamental human right, just like people who go to public school, just like people who get water from the faucet, just like people who call the police and the police come to their house. Health care needs to be a basic fundamental right. And remember, this is not socialized medicine, as our critics claim. It is a privately delivered healthcare system that is publicly financed. That's very important that we understand that.